A hospitalist is a physician who takes care of patients in the hospital. So they drive their name from where they work rather than driving their name from the organ or the patient population that they treat. Hospitalists have width as well as depth of knowledge in common medical conditions that lead to patients' hospitalization. They could be specialists in certain areas of hospital medicine, like cancer care or surgical care, or could be more of a generalist who are taking care of the medical patients in various wards in our hospital. They take care of the patient from the time they're admitted to the time they're discharged.
Hospitalists in Canada have been around for probably about 25 years in various forms. A lot of hospitalists are deployed in smaller and community hospitals, and none of them have really been deployed in as comprehensive fashion as we have here at the Juravinski Hospital. The hospitalists really allow us a chance to innovate, not only in our current state with how we provide care, but in the future. So we've implemented our hospitalist programs. Now the patients here at the Juravinski have a consistent access to the right type of physicians who specialize only in hospital type of medicine. And as well, we've started now to look at how we can innovate to do care differently, how we can improve care at the Juravinski for patients, and how we can move our whole system forward. So it's a really unique opportunity by partnering with the university and having actually a training program for hospitalists. We are giving back and we're training the next generation of physicians who are going to be providing hospitalist care across the country.
They're taking care of the patients from admission to discharge. They're quarterbacking their care with the nurses, the physiotherapists, the occupational therapists, the social worker, the psycho-spiritual care, and others, physicians, specialists, and consultants. They're checking on them every day, ensuring that they're progressing their care, compared to what we usually see in hospitalized patients, where there are residents and other trainees checking on the patient and then reporting to the supervising physician. Hospitalists usually provide their direct care to the patient, so there be some more consistency, and you see benefit of having one person caring for you during the hospital stay.
The innovation that we're looking at now with hospitalists involve a lot of different things. So it's everything from how we admit patients, and do we actually need to admit patients? Can we provide them with care, patients with care in a different fashion, so they don't need to be in our hospital? Most people don't want to be in a hospital, so how can we provide that care better? It's also looking at ways within our hospital site to provide care more effectively and more efficiently. So when somebody gets admitted, how long do they spend here? Do they need to spend as much time here? Again, people don't want to be in hospital, and so how can we get people out as quickly as possible? And then lastly, when people leave or are discharged from our programs, how do we make sure that they don't need to come back in? So how do we follow up with community, with our family physicians, with home care? And how do we provide that wraparound coverage so that patients won't get readmitted in the future?
Because of the struggles hospitals have right now in terms of hospital beds, I believe that hospitalist is the wave of the future, because we need to not only physicians who care for one patient in the hospital, but care for the whole hospital.